Hello, doctors and practitioners. This is Dr. John Brimhall. We have a real treat for you tonight. Those of you listening live and those of you who are listening to this afterwards. One thing I want to bring to your mind here, the top of this slide says inflammation, the _1 cause of disease. There's an incredible amount of research right now that states the underlying cause of all diseases is inflammation. And it doesn't matter, according to the research, whether you're talking about cancer, diabetes, liver, gallbladder, the #1 thing underlying when the degeneration is inflammation. So anything we can do to understand the cause of inflammation, and we know heat, red, swelling, and pain back from our school days is what inflammation is all about. We know that if there's a wound or an irritation, inflammation has to happen to begin the healing process. But when it gets carried away, it becomes a death trap. So we're going to turn the time over to Doug Grant here for a minute, and I'll close up as he finishes. But Doug is an inventor. He's a formulator. He is a athlete trainer. He's a very fit human being, and he's raising sons even bigger. If you haven't seen the pictures of his sons, all natural products, how they work and win contests in bodybuilding, it's a real treat. Doug, let's turn it over to you.
Well, thanks, Dr. John, and we're real excited tonight. I've already received over 5 texts from doctors and clinics that because of family holiday things going on, they're looking forward to getting this webinar and watching it because they're excited about this topic. And as I start, I really want to impress upon everyone the importance of understanding Dr. Brimhall's words and who he is, being the practitioner that is known, throughout the nation and throughout the world as one of the founders of the wellness movement, and his work in this area. It's really important to understand the power when he talks about inflammation and how serious of a concern it is to all disease. And very excited to bring this webinar to you. We're going to go fast and furious. There's some great research to help you understand that there are natural alternatives that aren't just okay, but are actually better than the NSAIDs and the things out there today that people are taking for inflammation that might be acute inflammation, but we're going to be talking also about chronic inflammation, and that's really, when we talk about the leading cause of disease, that's where it comes from. My background is a bachelor's degree in nutrition and postgrad work from the American College of Sports Medicine, and it's brought an interesting career as I've worked with Dr. Brimhall and thousands of doctors across the nation as we've taught clinics and worked in clinics and really ran the gamut with patients, but also with professional athletes who experience inflammation all the time, not just in sprained ankles or arms or anything like that, but as far as actual chronic inflammation because of excess exercise, the stress of traveling and work and so on. And so we're very, very knowledgeable and excited to bring you the latest research on this subject. Now, there's a lot of people that will claim the #1 cause of disease are different things, from free radicals to obesity to lack of exercise, vitamin D deficiency causing different things and so on. But there is one area that the majority, in fact, if not all, practitioners will admit is one of, if not the leading cause of disease today, and it is inflammation. It's a very destructive process. One of the great research journals and found by Karen said that it's now clear that the destructive capacity of chronic inflammation is unprecedented among physiologic processes. In other words, we know that the destruction that chronic inflammation causes to the body is huge. That's unlike anything we've known before, maybe save cancer, but yet this is one thing we know that actually leads to cancer. Is speaking with Dr. Brimhall earlier today and him citing that research and how much that bothered him, that people don't understand that. And I think it's very important for everyone to understand that inflammation, this chronic inflammation, it's crucial for healing, but long term, it's the major cause of problems, and we need to head it off. And we think on a daily basis it might not be bothering us, and so people let it go, when in reality it's the thing that causes most of the diseases that come up. And so because it's something that's not nagging you on a huge level each day, many times we overlook it. And that's why it's important to have this seminar. It's also important to understand why we've created went to great lengths to create some great literature to give to your patients and systems to make it easier to teach about this important concept. There are many conditions caused by inflammation. The Center for Disease Control states that even 7 out of the top 10 leading causes of death, mortality, are related to inflammation. Now, for them to say that, that's based off of all the analytics and statistics of causes of death, tracing back to inflammation, heart disease, cancer, chronic respiratory disease, stroke, Alzheimer's, diabetes, and nephritis. So we know through just analyzing the data, you know, something that Clark's big on, and we're real big with your clinics to understand the importance of your work and how you're doing, but just analyzing the data from a perspective of health, we know for a fact that 7 of the 10 leading causes of death is due to inflammation, this chronic inflammation, low-grade inflammation. What causes it? Excess body fat causes it. High processed fats, high calorie meals. It's called digestive leukocytosis. One of the great mentors for me and even Dr. Brimhall way back when proved that your white blood cell count elevates dramatically. Digestive leukocytosis when we eat too much food or high cooked food. Obesity, smoking, alcohol, excessive stress, lack of sleep, which is interesting, we'll talk about, and the lack of antioxidants. Now, this excess body fat thing, how do we know that? I mean, we measure body fat of our athletes and people all over the world, and sometimes I'm flown different places just to measure body fat. But the simple way is this: just measure your waist. You know, for every inch your waist is above what it should be, you have a dramatic increase of inflammation. So measure it right now. And if you know it's larger than it should, then you already know what to do. But if it goes up, then you really know you're heading the wrong direction. It's about the direction you're going, not where you're at right now. We need to start heading the right direction. And that body fat, you can really tell by just your waist measurement. There's an index created called the Inflammatory Index. It's an index created through years and years of research, and they just show that certain habits create chronic inflammation while others eliminate it. So simply, we need to understand what causes chronic inflammation in the body, and then look at the things that have been proven through research to eliminate it, make those lifestyle changes, and boom, we're on our way. And so that's what we've done. Now, everything we're going to teach you in the next few minutes is available in a special health report booklet that we've created called Inflammation, the #1 cause of disease. It's a full-color booklet. We can customize it with your clinic's name on it, so it is a Brimhall Wellness Center, Kiefer Clinic, whatever it might be that your clinic, you name you want on it, and then you have it there and you give it to your patients. It teaches them the things we're going to go over right now. It shows them the importance of staying away from the top 10 causes of inflammation and also to start doing the top 10 things that eliminate it. We're going to go through them pretty quick to help understand it and then stick a lot on the research of the specific nutrients to reduce inflammation better than NSAIDs. First inflammation cause is eating too much food, as we talked about, poor digestion or digestive leukocytosis. The answer, eat more raw food and take a digestion formula. There's a reason why it's the #1 selling formula in the market now for over 15 years, because it's a key to help reduce chronic inflammation by not allowing inflammation to be caused from not digestion of food. The second problem is processed white flour. Answer, stop eating it. It's pretty simple. White flour is extremely bad. A simple way to explain it is, what do your children do in kindergarten to make paste? They mix white flour and water. That is what's caused in the body, paste, and your body has a hard time breaking it down. It causes chronic inflammation. Next thing, sugar. We know that sugar's reactions in the body through the insulin and what happens in the adrenals throughout the body causes, and the acidic nature, the proteoglycans that are caused from it cause inflammation. The answer, switch to non-inflammatory sweeteners like honey, stevia, and if you haven't heard of it, a great new sweetener that's actually even the best tasting called monk fruit. The fourth inflammatory factor is fried foods, and there is no other answer except stop eating the fried foods. The chemical structure changes that happen to fats when we fry them cause immediate inflammation in the body, immediate inflammation, and we've got to stay away from them. The answer, stay away from fried foods. The fifth cause is animal meat and purine-laden proteins. Now, I know this causes a reaction because those of us that eat organic and grass-fed red meats and proteins don't have as high of inflammatory markers, and that is true. But the USC study showed that there's a 400% increase in cancer risk and inflammation with animal protein consumption. And this was done with the non-organic, but just the red meat you buy from the store. So the answer is to eat more plant-based proteins. And if you do choose to eat animal meats, make sure they're of the purest nature without antibiotics and hormones. Nitrates that are found in deli meats. A lot of people confuse this with the need to take nitrate-consuming fruits and vegetables to boost your nitric oxide. Completely different. These form of nitrates, especially when they're cooked, cause a structure change that within the body causes inflammation in the body, and it doesn't help with nitric oxide. It actually does the opposite. So the nitrates, we're talking about deli meats and those things we need to stay away from. Nowadays, you can actually look at the meats and it'll tell you if it's nitrate-free. The seventh, alcohol. Time flies when you are having rum, and you can see that's true. It flies by too fast. It's very aging. We are not on the research. The best thing to do is to eliminate all alcohol. For those people that come and say, well, I'm going to have a little something, well, no doubt the red wine is less acidic to the body, but still the answer is to remove it if possible from your lifestyle. Number 8 is soda. Acid is the problem. All soda is made with carbonic or phosphoric acid. Those acids cause chronic inflammation throughout the body, especially if you drink sodas throughout the day. So your body starts to try to use a bicarbonate system to buffer the acid, and then you go throw it in again and throw it in again every 2 to 3 hours. Probably one of the biggest problems of chronic inflammation today is sodas. Is absolutely the thing that if you do nothing else in this new year, you need to get off sodas. Number 9, food additives, coloring, preservatives, MSG, high fructose corn syrups, the food dyes. Just be aware of them. The answer is to be educated. We try to do that within the special health report for your patients to help them kind of simply look for some of the biggest problems and stay away from them as much as possible. And the 10th is the lack of sleep and stress. The answer, we have another special report called the sleep report that you can read that gives answers to help you sleep better, things you can do in your room, things at night, different things, along with a great REM sleep product that's basically been a lifesaver for many people because it helps with the serotonin and dopamine levels to let your body and your mind calm down to sleep. And with the pre-digestion, it really makes a huge difference. So those are the 10 inflammatory causes of this chronic inflammation that's causing disease. So let's go into the anti-inflammatory choices. Number 1, fruits and veggies. Greatest research study shown that the thing that you can do proactively to reduce your risk of disease and inflammation the most is increase your servings of fruits and vegetables up to 10 servings a day. And most of us are consuming, the latest research shows 1 to 1.5. Just eat more fruits and vegetables. That's the answer. And in the days when it's tough, when you're in places where you don't have as much access, just take the Fruit and Veggie Plus. You're getting over 10 servings every time you take a serving of that, of raw fruits and vegetables. There's over 35 raw fruits and vegetables in each one. Does it take the place of fresh fruits and vegetables? No. You consume it with it and do the best you can at eating as much fresh fruits and vegetables a day. We have a goal in our family, every one of us, to consume at least 10 servings of fruits and vegetables a day, plus take the fruit and veggie. So just because of the importance we know of antioxidants today. The fruit and veggie formula is the only formula that I know of on the market with a government anti-inflammatory approval. In other words, we have a structure function claim approval based on human clinical studies stating that we can legally state that fruit and veggie creates healthy inflammatory response in the body. That is huge to be able to legally make that statement. The reason we can make that statement is fruit and veggies show to reduce chronic inflammation across the board in human clinical studies. Not mice studies, not rat studies, not monkey studies, but in human clinical studies. That's why no matter what, I have a serving of Fruit and Veggie Plus a day. Absolutely, I don't think I've missed a day in years. It's so important to keep that inflammation down and the antioxidant levels up. This is the human clinical study that was done on the fruit and veggie. I could spend days on this study. This is just a little graph I put together from some of the highlights of the study. But you'll notice in this graph on the bottom right that it inhibited the TNF-A-induced inflammatory response. We know that it can reduce the inflammatory response dramatically in the body. We know that it spikes oxygen and nitric oxide circulation. In the top middle, we know that it inhibits the ROS generation in whole blood. ROS meaning reactive oxygen species, which is another word for free radicals. So we're inhibiting chronic inflammation by inhibiting free radical involvement on the cellular level. I can't emphasize enough of how important it is to get our fruits and vegetables in, and then a good serving of fruit and veggie plus a day. It's the raw fruits and vegetables and the combination of the top antioxidant-rich fruits and vegetables from around the world that enabled this research study to be so positive toward it. The second thing is salmon. Twice a week, according to the studies, a piece of salmon is to help reduce the inflammatory factors due to, I'm sure, the fatty acid levels in them. Number 3, olive oil, 2 to 3 tablespoons daily. I don't think most of us have enough of the good, healthy olive oils within our diet, like on our salads and so forth. I put some in the shakes, and very important to do. Fourth thing is plant enzymes, specifically protease, and we'll talk more about that. The enzymes have been shown to reduce inflammation in the body dramatically. Plant enzymes are actually the most used anti-inflammatory in the world, except the United States. I had the opportunity to travel to Russia and also to other countries that were playing professional basketball and with the athletes, and it was amazing how many of them used bromelains and different forms of plant enzymes when they had inflammation because they didn't want to cause bleeding in the stomach and those things that NSAIDs cause, and how little it's done in the United States. And they're getting great and have got great results for years and years and years and years. It's amazing what Big Pharma can do here to shy us away from the natural alternatives. So what we did today, the most common treatment for pain is NSAIDs and non-steroidal anti-inflammatory drugs. Now, the FDA even believes that there's 20,000 deaths that occur from severe bleeding due to NSAIDs. That's talking about you taking an aspirin or ibuprofen and you immediately bleed out from taking that. And you go to the hospital and you die. Over 20,000 deaths just from that, let alone to the deaths that are caused from it over time. And the problem is also that it causes kidney disease. 3,000 aspirins equals 1 kilogram, and a kilogram is what causes the kidney disease. And you're thinking, well, I don't take a 3,000 aspirin. Well, the problem is the cumulative effect because the kidneys don't regenerate like that. And so 3 aspirins a day for 3 years is a kilogram. That's very serious. And so we're talking about over time, you're taking aspirin. Let's say you don't take 3 aspirins a day. Maybe it's once a day. Maybe it's even once every week or month. You're talking from 3 to 10 to even 15, 20 years. If you're taking aspirin, you are causing this buildup in the kidney that leads to kidney problems. And so we know that it's a huge problem. If you take a look at it, the NSAIDs actually kills more people than asthmas and multiple myelomas and also cervical cancer. So we know it's a huge issue. The process of inflammation is one that I won't necessarily get into heavy detail with, but we understand the changes that happens when there's pain and swelling and inflammation in the body. And there's mediators called prostaglandins that come in, the good prostaglandins and the bad prostaglandins. And we can see what happens in the muscle tissue when inflammation happens, of how the body, there's the tear, and the body will come in and start getting rid of that scar tissue and start filling it in. And eventually we get back to, this is the muscle, of course, get back to the clean muscle. Well, the speed at which this happens is based on the prostaglandins. And the benefit, the simple way to explain it is that there's good and bad prostaglandins. The bad ones are called PGE2, and the good prostaglandins, we'll call them PG1s, they decrease the transmission of the pain and inflammation. The PGE2s actually cause more of it, and it's important for there to be a balance. Well, the NSAIDs block both types of prostaglandins, the good and the bad. So they can reduce swelling, but they don't improve healing process because they're slowing down the good prostaglandins that actually speed up healing. They're only, since they're blocking both, you reduce inflammation but also reduce healing time. And in this study that we did at the University of Toronto, it was done with hockey players, we showed the group that didn't take NSAIDs, their swelling stayed high. The acute, people took our acute formula, the swelling came down quite well, and the NSAIDs came down quite well also. So we were able to reduce swelling at the same rate as NSAIDs. We're talking about the specific acute, optimal acute formula. We're able to reduce the same, and you're thinking, okay, well, good, that's just the same. But the phenomenal news is the time that it took to actually heal. In other words, on the previous slides, to actually see where the muscle was completely healed and the tissue was healed, not just swelling down. And you'll see the group that didn't take NSAIDs actually healed faster than the group on the far right who took the NSAIDs. Why? Because the group that didn't take the NSAIDs didn't have the good prostaglandins blocked like the NSAIDs did. So it actually took longer to heal, but if you look down at people that took the acute, they were actually to heal 3 times faster than the group that took the NSAIDs. So there's a difference between having the swelling down and actually being healed so that you can perform the same activities. That's what we're talking about. When we're talking about chronic inflammation, we're talking about being able to reduce that inflammation and let that tissues heal so that we don't get the disease. So you can see it from an acute inflammatory response from a back pain, an injury, disc injury, whatever it might be, ankle injury, versus the same benefit even from chronic inflammation. You're just not going to see that benefit as fast as you did with a sprained ankle. There's been great studies on this, double-blind studies on boxers, soccer players, showing that with athletic injuries, acute injuries, and chronic inflammation issues that we're talking about tonight, that the protease enzymes, peptidase, bromelains, and antioxidants reduce inflammation and speed healing faster than NSAIDs. It's crazy that this information is out there and how important it is. And one thing Dr. Brimhall mentioned earlier today, he goes, it's a sad thing that this is for some doctors old news, but yet we're not doing enough about it. So we've got to preach it again. But this time I think the key is that we preach it from the rooftops, that it's not just about reducing acute inflammation, but it's about reducing the chronic inflammation that we know causes major disease today. And the antioxidants and those things are important. Yes?
We always try to name things where it's easy for doctors to understand. So it's pretty easy, opti-adrenal, opti-thyroid, and incidentally, doctors, we have opti-mitoforce coming out also between now and homecoming. We have opti-immune coming out between now and homecoming, and we also have an opti-iodine coming out. So we want to make it really easy. Help us understand, Doug, here. Acute sounds like anything acute injury we take it for, but we also know for inflammation acute's good for, and because it has all the enzymes in it, we know it would help gluten sensitivity, incomplete digestion, chronic inflammation, irritable bowel. I mean, it looks like acute could be benefited by almost anybody. And tell us about chronic. How do we know when to use chronic? How do we know when to use acute? Because we have optimal acute, optimal chronic.
Good question. The optimal acute formula, we usually recommend it, as Dr. Brimhall said, in acute inflammatory conditions, whether it be anything from, the acute injuries or any conditions that is needed from, gluten sensitivity or anything like that. But it's also taking 1 or 2 a day for chronic inflammation is really important. The chronic formula, optimal chronic, that Dr. Brimhall is talking about is a formula that has some anti-inflammatory help with bromelains and that, but it also contains all of the very specific nutrients to actually heal tendons and tissues that are very hard to heal, your glucosamines and your chondroitins, but they're pre-digested, what makes it much different. We've had athletes, I had one athlete say to me, says, Doug, I've taken chondroitin and glucosamine for years and didn't do any good. I took this for 3 weeks and I'm all better. What's the difference? Well, because it's pre-digested, it's delivered to the cell level, and a lot of people have a hard time breaking the glucosamines and those things down. So the acute formula, you can use it for any type of inflammation, whether it's acute inflammation or long-term chronic, and the chronic formula is mainly for the tissue rebuilding of tendons and ligaments and joints.
Tell me one more thing here now before we get off the subject. How does muscle RX fit into that? Acute for acute injuries, but also good. Take it in between meals rather than with meals. If you take it with meals, you're going to digest your food better. But in between meals, it's going to do a little bit better for the inflammation process. Now you're saying chronic is for any chronic condition, so it looks like we can mix them together. How does muscle RX fit into that?
Well, it's a great question. And you think about the chronic formula is for your heavy-duty tendons, your white muscle-type tissues that need that that glucosamines and that layers laid down. The muscle RX is for the muscle itself, and there's nothing better to help heal the muscle, to keep it from going into catabolism or sarcopenia, age-related muscle loss and so forth. So you can kind of see where Dr. Brimhall's going, because he understands so much better the human body and the physiology and these formulas. Is you're using the acute to reduce inflammation, you're using the chronic if it's a serious joint issue, and you're using the muscle RX for muscle itself, that you need the body to build muscle to help support the spine, whether you're needing it to rebuild the muscle from an injury, so on and so forth. So you can see that great synergism there, and it's really important to point out. Thanks, Dr. Brimhall. All right, run through these. Number 5 on the good list, to reduce inflammation. Remember, we're on the reduce inflammation list. Almonds, walnuts, flax seeds, macadamia, hazel, pecans, raw nuts, great anti-inflammatory. Then the specific herbs and spices that are in our formulas, the green teas, the turmerics, the cinnamons, the garlics, all those are in fruit and veggie. They're in the new Opta Mito that's coming out real soon, and longevity and those types of things. But number 7, dark chocolate, one of my favorite. This one's not tough for me. I love dark chocolate. 70% or more. If you're new to dark chocolate, 70% is about all you can do. It's an acquired taste for the higher levels. Great anti-inflammatory. And the more sleep issue, ask for the sleep disorder special report. It helps your patients see the things they need to be able to improve their sleep, along with taking the REM sleep to get them into REM sleep longer. REM sleep is another webinar, but we have research to show, university research, that it keeps you in REM sleep longer on this formula than not being on it. Number 9, exercise. A lot of you seen those shirts running around nowadays, exercise. I thought you said extra fries. We mean exercise. Starting the new year, got to get moving. A lot of people think exercise is inflammatory, when in all reality, good consistent exercise each day, 30 to 40 minutes, is anti-inflammatory in the body. Micronutrients.
If people are having trouble getting injured exercising, take the Opti-Adrenal just prior to the workout, because that keeps that ligament stretch from allowing us to injure ourselves. And also, you could take some of the digestive enzyme or the Acute to cut down the inflammation in your workout process. So I think that's a real good thing to remember. Take Opti-Adrenal prior to your workout.
Is it absolutely, like you're mentioning, the Acute, there's actually studies done on the Acute with people before events, workouts, athletic events, and so on, and they actually reduced inflammation from happening. So we know there's other micronutrients that we know of in longevity, with the K2 and vitamin D and so on, that help with this. So basically, inflammation we know is a silent killer. It's the #1 killer, completely avoidable with lifestyle. Acute with the fruit and veggie and inflammation report is the best product system that we've really ever created. It is the special health report goes through, it teaches them about these 10 causes and 10 things they can do to fix it, and then it also goes through and teaches them the research from Acute, the research on fruit and veggie. And it's a new day dawning for inflammatory solutions. You give your patient the special health report and these 2 formulas, and you'll see tremendous results. We have a special inflammation webinar special. Call next couple of days and get 20% off those formulas for the next 48 hours. You need to mention that you were on the inflammation webinar, though, to get it. And so, Dr. Brimhall, I want to kind of, I think, send it back to you for a minute to close up, and I'll get the screen back again.
Well, good. I don't know if there's any way, Clark, can you flip me over where I'm a presenter, or I can pop up another slide or not? I'm not sure. If you can, fine. But let me close down here in case we can't. Doctors and
yes, Dr. John, we can do that. I can switch it to you.
Okay, tell me when you see me. We wanted to keep this kind of a short seminar tonight. Unusual. What we can do is
okay, your screen's up, Dr. John.
Perfect. But what I wanted to do is make sure all of you have on your agenda to make it to our 2016 wellness seminar that we have in actually Phoenix, Arizona, Tempe. They're side by side. It's about 15 minutes from the Phoenix airport, so you can fly into there. And never before has there been 9 speakers that are so highly qualified in each of their areas as we have here. And I want to show you some of the things that we're going to be going over. Doug is going to have 6 hours of instruction where he can take you through all the different whole, non-GMO, whole foods, that pre-digested that we use in all of our formulas. We talk about longevity and muscle RX and some of the incredible results that we're getting. Imagine if you could take a nutrition that increased your digestion, absorption, and utilization by 300%. Well, that's all OHS products. That's every single one of them. So when I formulate a product, I make it the same as I used to when I did for myself or other companies that I formulated for. But in this case, when you have non-GMO whole foods, we pre-digest them and they're pre-methylated naturally, you increase the absorption utilization by 300%. I mean, it's beyond our comprehension, but that's what's happening. So you need to learn how to use OHS formulas. And here's a very specific study that was done in Dr. Jesse Liebman's, a certified doctor from New Jersey. And they were talking about a patient who came in to see them, and they had degeneration so bad in the feet and the legs, their legs and feet were actually dying. I mean, how much longer they could have gone on and not had them amputated, nobody knows for sure, but it couldn't have been long. And it tells you had 10 layers of gauze that were soaking through. Patients losing their balance, and they couldn't stand up without falling over. They had constant, relentless itching sensation in their legs and in the body. And they'd been told that there was nothing could ever change this medically. And this is what it looked like. And now, the reason this ties into what we're talking about here, every chronic degenerative disease has inflammation as a base. What are you going to do for this person with inflammation? Well, we put them on the acute formula. We put them on fruits and veggies. But most importantly, when you're treating a peripheral neuropathy or degeneration of this level, you want to put them on the methylated Bs. These Bs that we use are the only formula I know that are organically methylated, because 50% of the American population have a methylation problem. And remember, the most important thing we do on a day-to-day basis is take in oxygen and then give off toxins. The second most important thing we do is methylate, because that allows us to detoxify. But you can tell this person didn't have oxygen to the area, didn't have proper blood supply, he wasn't able to detoxify. So we put him on optinitric, of course. We put him on the methylated B, of course. We want to increase circulation and healing. Almost anywhere in the body, you have to have iodine. You have to have vitamin D. You have to have oxygen to the tissues. So in this particular case, then, of course, you want to put on longevity, because it has CoQ10, it has vitamin D, and it has the K2 that draws the calcium where it's depositing, where it doesn't belong, like in arteries, atherosclerosis, and arteriosclerosis, and puts it back in the tissues where it does belong, like the bone and teeth. So this person was under care using OHS nutrition, the peripheral neuropathy outlay that we're going to be teaching at Homecoming 2016, the last 3 days of January. Call the office if you're not scheduled. Get scheduled, because watch this. So here's what he looked like in the beginning. And it literally, they were oozing out of here. And I said it soaked through 10 bandages a day, and you could tell that tissue was just rotting and dying off. This is before they came into a certified Brimhall practitioner. All before quality. No quality of life. Now, they begin treatment here from 9/10 to 12/10. So in 3 months' time, after using optinitric, methylated B, and the Bemer every day, along with Jonathan Walker's peripheral neuropathy treatment that we're going to be teaching at Homecoming, look at the difference. Now, this is the same person, gang. The same person 90 days later after doing the Bemer every day and the OHS nutrition. If they say a picture's worth 1,000 words, how many thousands of words are these few slides worth here? And these were taken at home by his son. He saw such incredible changes that he took this, not even done at the doctor's office. Same person all the way through. So we went from the level of degeneration that you saw there to the level of regeneration. Now, I want to ask you something that you ask yourself. If you could take tissue that looked like this and regenerate it to a tissue that looks like this in 90 days, imagine what you could do with healthy tissue or mediocre problem tissue to get it to heal with the same nutrition and the same increasing the nutrients to the body and the oxygen level and hauling away the toxins. So Bemer, OHS nutrition, these are the kind of results we're getting. Dr. Jesse Liebman, the very first month he did the peripheral neuropathy treatment using the Bemer and using the OHS nutrition, he generated $27,000 extra just by following Dr. Walker's program. The worst month he's had was the third month, and it was only $60,000. That's because he became panicked how he's going to take care of all these patients till he got a better system going. He's averaging $80,000 a month extra above and beyond what he does in his chiropractic practice and his body contouring, which we also will teach at homecoming this year. So last month, and he gave me permission to do this, he actually collected right at $200,000, and 60 to 80 of it, 80 last month, was from doing peripheral neuropathy with the OHS nutrition. So gang, as I want to remind you, we have 9 speakers the last 3 days of January in Arizona. Call the office, 866-338-4883, or just go to brimhall.com, and it tells all about the webinars that we have all the time. There's a puzzle piece goes out to you every week, but it tells about homecoming. Please don't miss this. Don't rob yourself of the new innovations we have available, the new nutrition. The mitochondria that we've had in the past was a great product, but with the new pre-digested mitochondria product, we're going to change the world. Gang, we want to stop here tonight. We know it's a holiday season. We want to thank you for joining us. We're going to be sending this out to you the next couple of days so you can review it. If you want to have some of these slides to show to your patient, just shoot that to Clark, and we'll make sure that you get that out there. Clark, were there any questions we need to answer tonight? I don't hear him saying yes, so we're going to sign off. Good night. God bless you all. I'm hoping you had a Merry Christmas and you'll have a wonderful end of your 2015 and invigorating 2016. See you at homecoming. Good night.